Welcome to Lesson 2 of our patient orientation, which will focus on how engagement benefits researchers and patients. Again, my name is Ava, and I am a patient partner with ReachNet, and I helped co-develop this orientation. In today's session, we will briefly review engagement in patient-centered research. We will cover some benefits that are shared with all stakeholders involved, as well as benefits from the perspective of researchers, clinicians, and patients. As discussed in Lesson 1, in patient-centered health research, patient engagement is a highly valued part of the scientific process. Patients inform and affect change at every step of the research process. In ReachNet, patients are formal research team members that add their personal experience and expertise on an equal basis with professional researchers. Research projects are executed through the collaborative work of all team members. As collaboration occurs throughout the research process, knowledge and views are shared by team members. We all have different perspectives, and new and interesting ideas are brought to light. Researchers are able to immediately learn about the patient perspective and incorporate that voice into the research process. Mutual learning and understanding can even transform our points of views and our ideas. Teamwork also increases appreciation for diverse points of view. For both patients and researchers, working in patient-centered research builds professional skills. Resumes can be significantly enhanced with interpersonal and technical skills, such as computer softwares, research design tools, and grant writing. Research projects can also be added to the achievements and accomplishments section of a resume. All team members become potential professional references for future endeavors. For researchers especially, they may benefit from our backing as they pursue funding for patient-centered projects. Beyond references, we may also share our network of connections with fellow team members. Now we will go into specific benefits for each stakeholder group.
Hi, I'm Dr. Amanda Staiano. I'm Assistant Professor at LSU's Pennington Biomedical Research Center. I study ways to treat and prevent childhood obesity, and for my programs to be successful, I need to work with the children and the parents to figure out ways that they will learn better, to understand things that they care about, and to make sure our programs are being developed in a way that will really be effective for families. I'm really interested in how children can lose weight and how their health can be improved. But I find when I talk to parents and children, weight may not be the most important factor for them. And in fact, a lot of parents are concerned that their kids are being bullied at school because of their weight. They're concerned that their kids might have low self-esteem. And once I realized this, I've started to change my programs and change the type of data I'm collecting to make sure that I'm paying attention to what families really care about. So with my research, we're trying to figure out how do we speak to people in a way that they really understand the importance of making health behavior changes. Whenever my family might be diagnosed with a different disease, we try our best to get involved in the research. So we'll sign up for patient newsletters. I'll try to keep up to date on what's the latest research and clinical studies going on and share that with them. And we find that when we participate in research studies, not only are we helping ourselves, but we're also helping other patients around the country and throughout the world to make sure that the treatments that are being delivered are the cutting edge and top of the line treatments for our community.
There are multiple ways in which researchers may personally benefit. They gain a better understanding of our interest in, experience with, and commitment to research. Researchers also gain a better understanding of the real-world application of study questions and findings. Researchers build better relationships with patient team members and acquire insight into their interactions with stakeholders. Also, through patient-centered research, they will learn how to increase patient involvement in healthcare decisions and outcomes. And maybe most importantly for researchers, they are contributing to innovations in evidence-based healthcare that are applied in the real world. Researchers also benefit professionally by having an increased probability of completing projects. Oftentimes, projects can stall if there is poor enrollment and retention of study participants. By partnering with patients and using engaged patient advisory boards, researchers learn better ways to enhance recruitment and improve the investment, commitment, and retention of participants. When we are involved in the formation of a research question and in the data collection process, interventions are more likely to be appropriate to the study population. The quality of data is likely to be superior in terms of reliability and validity. Studies also have increased credibility, which leads to more funding options and reduced criticisms about the relevance and application of study findings. Now we will talk about the benefits for stakeholders providing healthcare. There are various ways in which clinical healthcare providers may benefit. Clinicians are on the front lines of implementing advances in healthcare made through clinical research. They are able to contribute to medical discovery and learn about and implement best practices for care. As stakeholders, clinicians empower their patients by helping them to create a space for patient voices and influence. When patients are stakeholders in research, our partnerships with clinicians in healthcare are strengthened. Traditionally, there has been a top-down approach to care, where clinicians may have exclusive access to and full responsibility for healthcare knowledge. As stakeholders, we patients are equally invested in and shape the research process. We can drive dissemination of study findings to the benefit of the healthcare field. As we are increasingly informed, we can share knowledge and medical discovery with our various healthcare providers. As the healthcare environment in the U.S. shifts more to outcome-based insurance reimbursement, medical providers benefit when patients undertake more responsibility for health. We've covered the benefits for researchers and medical providers, and we will now transition into how patients should personally benefit as well. I'm Ava Zubrick, and I'm a patient partner with ReachNet. I learned about patient-centered research through my own experience with disease. After years of struggling with obesity and weight management, I began to finally understand it and to learn about evidence-based treatment. This inspired me to contribute to the field of obesity care, and I sought out ways to connect with patient advocacy and with research. I decided to become a patient partner after meeting with a researcher who specializes in my diagnosis, and she told me about ReachNet. The researcher expressed that my background, my unique perspective, and my patient voice could be very important in shaping research projects. Research should include the patient voice because without it, researchers and clinicians can have blind spots. Patients can contribute important suggestions, and I can share a particular example. For one study, I serve on the Project Management Committee, which handles operational planning. We were discussing an upcoming screening and recruitment event, and I pointed out a potential issue with the setup. Having a high number of research staff in the room while patients are being measured and weighed could make the patient's stress levels increase and blood pressure go up. This could skew the initial data. Patient partners can benefit personally in a number of ways. We gain a better understanding of the research process and how the design of a study can impact the validity and application of any study results. Because we're involved in every step of the research process, including the design of the study, we gain confidence that research addresses issues that are relevant to patients like ourselves. We can help ensure that research is conducted in a sensitive and respectful way and that results are accurate. We can also improve researchers' understanding about our personal medical conditions. Engagement also provides opportunities to network with team members and other patients, and we can support each other. In Lesson 1, we discussed in detail how patients are involved in every step of the research process. Again, we influence how scientists approach various medical questions. This ensures that the topics studied and methods used are relevant and important to patients. Then, by sharing our experiential expertise throughout the process, we contribute to the advancement of the field. Our engagement improves research and advances healthcare knowledge. In turn, we have direct access to findings that can improve our health and the health of patients like ourselves. In today's lesson, we discussed the various benefits of patient engagement. Patients benefit directly, as do the researchers and clinicians who work in patient-centered research. When all stakeholders collaborate, the innovation of evidence-based healthcare can be more seamlessly implemented. We can first improve the process of identifying study populations and research questions. We ensure that those who may benefit most are identified, recruited, and treated in an appropriate and dignified manner. With our experience, patients are in the best position to resolve potentially confusing or offensive measurement practices from the perspective of study participants. With our help, study findings are more likely to reach the relevant patient populations. When study outcomes are appropriately disseminated, the healthcare recommendations are more likely to be widely implemented. With these things in mind, we will now move on to the Lesson 2 activity. In this activity, you will describe 3 ways that you may personally benefit from engagement in research.